Good afternoon, and I would like to thank the organizers for the invitation to talk about the implementation of PrEP and the community perspective from Barcelona, Spain. So I will talk a little bit about the history of our organization. It was established in 1993 as a patient organization to provide peer support to people living with HIV and AIDS, to give visibility about AIDS and emotional support and information about treatments and clinical trials. Remember, that was before efficient treatment really existed. Then during those years, every time HIV was better controlled, treatments were less toxic. So then we thought it would be nice to stimulate testing. And in 2006, we opened a community center, Barcelona Checkpoint, for men who have sex with men and transgender women to increase uptake of free HIV and STI testing. Now, a community center for us do has to comply with two key factors. One, it's peer-led, meaning that all members working there are gay, and some of us are HIV positive, and to use point of care testing. So people come in for test and will know the result at the same time. These are the results of our cohort. We follow HIV negative MSM, and you can see that increasing the frequency of testing, detecting earlier by using technology of viral load to detect acute HIV infections and start earlier treatment, has brought us to a decrease of HIV incidence of 60%, where it was 4.1 in the early years. In the latest years, it was 1.6. And these results were published in the International Journal of STI and AIDS this year. Then in 2015, the PROUD and the IPRA case study were presented at the CROI conference. And with the good results, we thought it was a good moment to inform the community about PrEP, and at the same time to demand to the health authorities the approval and implementation of PrEP within the fight against HIV. Then the next year, in 2016, we also participated in a European survey, the FLASH PrEP in Europe study. And one of the results, which I thought was interesting, was that people thought, at least 85% thought that PrEP should be delivered in a comprehensive prevention package. And for delivery, places like a community-based center and a GP were identified as preferred places. Then in 2016, PrEP was approved in Europe, but not yet in the individual member states. But already in 2016 in Spain, there was the guidelines presented, and as a community, we were part of those guidelines, writing a part, one of the chapters. What were the next steps? Well, our experience of HIV testing and STI testing give us a perfect situation to develop a demonstration project. We did that in collaboration with a center in Madrid, and we were almost done with the demonstration project, but at the last moment it was blocked by the Spanish Ministry of Health, which wanted to do their own feasibility study. Then, because of this effort and experience, at the end of 2016, Barcelona Checkpoint was selected to recruit for the Discover study. And we started in March 2017. We recruited a lot of people, and we were one of the first recruiting places in Europe. and the third at the world level. Then in 2017, we also decided that people who were not able to get access to PrEP through studies were buying online, and that moment it was done in the UK, which was the only European country where it was legal to buy online. And we decided to support those members by giving them information about how to do it in the right way and to do the checkups. Then at the end of 2017, we thought with all this package, it was time to open a new community center. And the name was Barcelona PrEP Point. PrEP was still not approved in Spain though, but we thought it would be a good step to normalize PrEP, to incorporate it in the HIV prevention package. Here you see some images. It's next door to Barcelona Checkpoint. It has an own lab and a lot of POC, point of care testing. Now, with the years between 2017 and 2019, we started with the Discover study, 245 participants. Later came also the feasibility study from the Spanish ministry along with, for which we recruited 175 participants, and a feasibility study from Catalonia with 73 participants that gave at least access to PrEP to almost 500 persons. Now, for the people who decided to buy online PrEP, we gave information sessions, we organized information sessions, which were between 2017 and 2019, attended by almost 1,000 persons. Of those, around 700 persons started PrEP with a baseline visit. So at least 700 people more accessed PrEP in those years. And then at the end, finally, Spain approved PrEP at a national level. And in Catalonia, Barcelona PrEP Point, due to the experience they have added in those years, was officially included as a community place to deliver PrEP. Our team is still using the same principles, composed by peers. These are physicians, nurses, pharmacists, counselors, coordinators, and also psychologists, because we think an integrative approach is necessary, especially if there's also items or issues like chemsex involved. The other important development was that we considered that PrEP should be led by nurses. Nurses have a special role, and they really connect very well with the clients. I think that outside Europe, there is more experience, but in Europe and especially in Spain, there isn't a lot of experience with that. On the other side, all participants that participated in studies, the feasibility study from Spain and Catalonia, went over to the formal PrEP program without discontinuation. And we offered also to all buyers online to enter into the program. On the other side, in Barcelona Checkpoint, people will come in for HIV and STI testing. They are at every visit informed about PrEP and how to enroll into the program. Now here you can see in the 8 months how the development after the PrEP approval was at the Barcelona PrEP Point. And you can see that we have around 1,356 people in the program. Now, you see that it's not a very steady increase, but we have to remember that on the 14th of March of this year, there was a state of alarm due to COVID-19. Now, Before the state of alarm, we had already one physician diagnosed with COVID-19, and therefore, of close contact, 75% of the team had to go into quarantine. The state of alarm meant a strict confinement, implying that people could only leave house or go to work if they had a declaration with them. And our challenges in the Barcelona checkpoint and the PrEP point were the continuity of HIV and STI testing, PrEP delivery, and the continuity of clinical trials, to give support to people living with HIV, those who were recently diagnosed and had needed to get access to the treatments and controls, and people who were probably from other European countries were displaced and weren't able to get back to their home and missing their doses of treatment. And finally, the psychological support for people who were living alone or were using recreational drugs. And we also wanted to look, and we created a survey to see the differences between people who are PrEP users and non-PrEP users, if there was a protective effect on antiretroviral treatment. Now, I won't go into all these aspects, but I just want to look about the PrEP delivery and the clinical trials. So the first week, what we did, everything was closed at that time. We made appointments only in the mornings, and every appointment every 30 minutes, so people won't cross each other, to deliver the PrEP medication. It was done by the other 25% of the team who was not in quarantine. But at the same week, we thought this wouldn't be the way forward. So we purchased home tests, and we decided to send medication by a courier together with an HIV home test. People would do the test at home and send the result, a photo, for example, by WhatsApp or email. After that, the physician or the nurse made a consultation by the telephone. We couldn't do STI testing because the labs were busy with COVID testing, so no possibility. And on the other side, we had put on a hold all the meetings, the information given to people, and also people who wanted to start PrEP, including those who had already done the baseline screening. And unfortunately, we had to create a waiting list for people to start PrEP. And that has increased so much that at the end of September, there were around 1,200 people on that waiting list. Now, we think after COVID-19, it's a good opportunity to think and adapt the PrEP procedures. On one side, develop PrEP guidelines, think about how many visits per year. Could it be just 2 in-person visits per year and 2 virtual visits? The STI checks, should it be 4 times or 2 times? And we can use telemedicine. Therefore, the other part would be the developing of an app where there's a dashboard where there's easy overview of people, of active PrEP users and non-active PrEP users and those on a waiting list, the management of agenda, consulting, medication, and home testing and sampling, and clients would be able to see their results on the app historically. So in summary, the community has responded very positively to the approval and implementation of the PrEP in Catalonia. Barcelona PrEP Point is an integrated peer health care delivery system that includes clinical care, pharmacy services, and psychological support. Implementation has slowed down due to the COVID-19 pandemic, but never stopped delivering PrEP and/or clinical trials. COVID-19 and a rapid uptake of PrEP has given the opportunity to think about an evolution of the guidelines and implementation of an efficient management tool tools that are needed to support PrEP adherence and monitor laboratory follow-up results. Now with this, I would like to thank you for your attention and also acknowledge all the members of the staff and volunteers for the incredible work they do in the checkpoint and the PrEP point. Thank you very much for your attention.